Hi there and welcome. I'm so thrilled to be part of the IAFNR conference this year, and I'm so glad I get to come together with so many of you and we can learn and review and push the boundaries of what's possible in functional neurology. So today I'll be sharing some insights and some protocols that have really helped some of my patients and also have helped me, particularly my patients that have been grappling with neurodegenerative conditions like Parkinson's. So in the next 50 minutes or so, we're going to explore a few things. We're going to talk about the neurological challenges that people who suffer with neurodegeneration deal with, but we're also going to talk about a case study that I applied some things I've learned from so many of you and just helped empower this specific person and his family. His name's Pedro. And I'm just going to hopefully give you some orientation into how I look at neurodegeneration and specifically in Parkinson's, and then some things that I've tried and several things that I failed on. But I just want to not just talk about protocols here, but I just want to give you some background and just solidify for a lot of you. I'm sure you know much of this already, but I did learn a lot as I prepared this presentation. So I just hope I can share with you a few things that will help you help your patients and enhance their quality of life and just make their lives better. So I have a few objectives. My first objective is to help you understand where Parkinsonism fits in the neurodegeneration continuum. And then we'll review some stages and some symptoms of Parkinsonism. And then I'll just share a video case study with some various different treatments that I tried, and we'll look at some of the results. So hopefully it'll be compelling to you and will give you hope to be able to try different things and fail. I mean, that's how our brain learns. So I hope I'm going to be able to help you have the courage to try some things and fail so your brain can learn how to help more people. Okay, so slide credit for this slide goes to Dartis Karazian. I'm really grateful for all the things I've learned from him, as well as from Brandon Brock and so many others. But the three main types of neurodegeneration are dementia, Parkinsonism, and cerebellar degeneration. And basically, when you look at these different degeneration patterns, you'll see that they all end up worsening and worsening over time with different initial symptoms, and then they end up affecting the frontal lobe, the prefrontal cortex, and it causes depression and difficulty concentrating. Basically, all the executive functions tend to go down, including endurance. You lose your ability to focus and to have attention, and especially lose working memory, which is something I am very grateful for. So let's go through. So let's just start with Parkinson's and look at some of the common symptoms. I liked this acronym, which helps you remember the four big ones. Tremor usually starts on one side or the other. Rigidity, it can affect everywhere, and it can affect the legs, the neck, the back, the face, the voice, everything. And then there's akinesia, which is basically loss of or impairment of the power of voluntary movement. I was just walking in from lunch today, and I saw this elderly gentleman trying to be helped by his wife to get out of the car to come into our building. It wasn't a patient in my practice, but I saw him, hesitating and trying to, turn a little bit and close the door at the same time he was trying to take a step. And I could just see all this stress, and his wife was trying to help him. And there's a curb right next to it, and I was sure he was going to fall. So I just went up and I helped grab him so she could move the car, go park. And I walked him inside, and it was just so, it was impactful to me to just see how someone that used to be so capable can literally struggle just to get into a doctor's office, and how long it can take and how frustrating it can be. So it was just one of those things that just happens today. It was like right in front of me. as we walked him in, we do have automatic doors. The other doctor's office was bringing down a wheelchair, and I just got him sat down. But I was just remembering so many of the things I learned about movement disorders and the stiffness and the difficulty and the shuffling, and how his foot would tremor and it would try to take a step, and I'm like, step over that line, step over that line. And he finally was able to, he would say, I can't. And then he would do it, and then he would start to take a few steps, and then suddenly he'd be shuffling again. It's just, I can tell he was really frustrated. Let's go through a few more of the symptoms. I mean, there's basically two divisions of the types of symptoms: just the slow movement, the resting tremor, which is usually on one side, usually the hand. You see that pill rolling tremor, but a lot of times you see it in the leg and the foot as well. Hallmark is rigidity and stiffness. People just cannot get themselves moving, and then that creates the difficulty with balance and walking. The other non-motor symptoms are a lot of times more disabling than the motor symptoms, but they're a lot more, they tend to be more invisible when you look at someone. Things like loss of smell, without smell. And, since COVID, a lot of people lost their sense of smell, which is something I guess we need to be aware of when we're examining neurodegenerative patients. But constipation, that usually happens a decade or two before Parkinson's symptoms show up. The low voice volume, difficulty swallowing. I've heard of several people who had trouble swallowing and choked and died from food. But then there's the disabling sleep disorders, the anxiety and depression, difficulty with thought, urinary urgency, which can also mess up the sleep, low blood pressure, which can cause dizziness and falls, and then hallucinations. I have family members, and I'll share this a little bit more later, but my aunt was going through some late stage Parkinson's a few years back, and my mom was very involved in taking care of her. And it's just really frustrating and overwhelming when these people you know and love starting to have hallucinations. They're seeing things that aren't there, and it just makes them very frantic. So the progression of Parkinson's symptoms is, it's sort of in a continuum. There's sort of prodromal Parkinson's disease, where you start to have some depression and constipation. That could be, like I mentioned earlier, years. But then once you start to get diagnosed in early stage Parkinson's, you'll have some bradykinesia with rigidity and tremors. And then as you progress through the mid stages, things tend to get worse. And then you'll end up having more and more postural instability and autonomic symptoms. And then it affects the actual identity, who you are and how you perceive the world, which can be those visual hallucinations. And then at some point, Parkinson's doesn't necessarily kill you, but all these other side effects, the balance and the falls and those things, is what eventually takes you. So as I was researching the different categories of Parkinsonism, I was just astounded by how many different varieties there are. Primary, this familiar Parkinson's, is mainly genetic. It occurs in about 15% of the cases. And then there's the early onset Parkinson's. Sometimes, Michael J. Fox has made that more famous, and he's earned, I shouldn't say earned, he's raised a ton of money for Parkinson's research. I think it's exceeded $1 or $2 billion at this point. But as treaters of Parkinsonism, we need to be aware of the other types of Parkinson's, the Parkinson's plus, the progressive supranuclear palsy, and the cortical basal degeneration and multiple system atrophy, which the prognosis is so much worse for those. They just don't last as long. It isn't as prolonged. In the secondary Parkinsonism, I don't know what the percentages are for each of these, but I know that I've had several patients with drug-induced Parkinsonism, several patients who've been exposed to pesticides and trichloroethylene and other organic solvents that have triggered Parkinson's symptoms, and then it ended up becoming Parkinson's a few years later. Then seen several studies about the side effects of brain trauma, that can lead to Parkinson's symptoms. And then, of course, infections, vascular events, strokes, and so forth can affect the same areas of the brainstem that are affected by the alpha-synuclein deposits and the tangles that occur there. And then a couple others that I hadn't learned until just recently is the normal pressure hydrocephalus can cause effects on the substantia nigra, and then of course demyelinating Parkinsonism, which is pretty rare. So there's the prion hypothesis. I sort of liked this image that shows the stages of how, and I've seen different things. The older stages that I researched back in 1967 are only 5 stages of a degeneration or progression through that stage. But in this prion hypothesis, you see the lowest levels of the brainstem getting affected. And then as you go through more and more stages, you're affecting more and more levels of the brainstem until it finally affects the cortex. And it just progresses through. So stage 1 is basically the earliest stage when the symptoms are mild. A lot of people don't even know they have it. They just maybe say that they're having essential tremor or something, and you just move on. But when you get into stage 2, you start to get more tremor and rigidity, and then you start to have things that are affecting both sides of the body, which makes it more difficult to function in your daily tasks. Stage 3 is when you're still capable of leading an independent life, but you're getting slower. I've had one patient who was in her mid-30s. She was a dental hygienist and had been fired from several jobs just because she was moving so slow. This is right before COVID. We started to treat her, and she, in just a few visits with some of these approaches, she was so happy and excited. She signed up for some exercise classes, some boxing, and was just doing great. But then COVID just shut everything down. So in her case, she was having significant trouble working and functioning at work because she was just so slow. When you get to stage 4, usually by this time you've definitely been diagnosed and you need help with almost every activity of daily living, and you're really not able to live alone. In stage 5, it's the most advanced and debilitating stage. Could be 6 in that other model, but you're confined to a wheelchair or bed, and you just need lots of care to keep functioning. So here's another view of it. This is from Nature's Reviews. Pretty good paper. I really would recommend this one. It's about 20 pages, but it has some good images and some fairly clear explanations of these different stages. You can just see those Braak stage 1 and 2, then progresses as the Lewy bodies in the substantia nigra go up higher, and then this final stage, Braak 5 and 6. So I just found just a few different papers that I thought were interesting. Drug-induced Parkinsonism, a common cause of Parkinsonism in older people. And it's just an increased risk factor. In most of these cases that are drug-induced, if they just stop the drug that started it, then they will, within a few months, return to normal, but some of those are not able to recover. So I thought that was an interesting paper. Another one that I hear a lot about, I'm thinking of a specific patient who's since passed away at this point, but he called me, wanted to talk, and he sent me some video about glyphosate, and he said, I'm not going to come in and see you. I've heard you're great, but I want you to see this, watch this video on glyphosate before I come and see you. And he was a gardener. He'd been exposed to glyphosate for years and years and years. And we made great progress with him until we sort of reached those later stages. And then we just let him be with his family towards the end. So glyphosates, I know there's some controversy in the literature, but I think there's fairly convincing evidence that glyphosate is something that is a neurotoxic to our nervous system, and we should not be touching it, breathing it, eating it, anything. I thought this is an interesting paper, updated intrinsic role of phytochemicals against glyphosate-induced neurotoxicity, a systematic review. And it's just talking about that, these pesticides and how there are certain things that you can take to sort of minimize the effects on the nervous system. So that was an interesting paper. Had another Parkinson's patient who, really brilliant engineer. He approached me. I'd known him 10 or 20 years ago, and when we were both younger. And I saw him at the park, and we chatted, and I noticed he had a tremor, and I asked him about it, and then we talked about it. As he came into the office and became a patient, he told me he, in his chemistry classes and in lots of his work, he handled TCE and did it without gloves. And it was just, it's one of those things. It's a chemical that is a solvent, and it basically is a degreaser, and it helps you just break down certain molecules so that you can dry clean and so forth. That's been recognized as being a neurotoxic as early as 1969. Anyway, this patient had told me about it, said, yeah, I think that's when I got my first exposure, because he noticed that he felt a lot different while he was working at that job. I think it was an internship for a year or something. But 10, 15, 20 years later is when he had full-blown symptoms. Another study I thought was interesting, biological links between traumatic brain injury and Parkinson's. And this is just sort of a review of some of the different causes, among others, traumatic brain injury. And it just reviews the mechanism of how inflammation can make Parkinson's worse, metabolic dysregulation, and how it just affects the ability of the brain to function properly. So I do want to share with you this case study. And I've got some videos. My case study is about a gentleman, amazing gentleman named Pedro. And I've received permission from his wife to share this. And he was, when I first met him, he was sent to me by a doctor in North Carolina, amazing functional practitioner. And this doctor had done amazing functional medicine workup on him. And it made my job so much easier, because I didn't have to worry about a lot of those things. He had already taken care. He had an amazing supplement program. He had had blood work done. He had things to do to heal his gut. So many good things had already been done when I started this case. But he was a husband, a father, a grandfather, and he had a few complaints. He had recently moved to Utah to be with his daughter, about 20 minutes from my office. And he'd had a couple days prior a fall down the steps, maybe 1 or 2 steps just over the weekend, and it had just started snowing. It was late October, and he had fell down twice off the porch. And he'd been treated in the ER, and they did some x-rays and found they were negative. So his complaints were, as related by him and his wife, severe flank pain, obviously from where he hit his ribs. He had bruising on the side as well. And he had lots of trouble with movement, he had you'll see in a moment, postural trunk and a tilt to the left. And he had lots of trouble sleeping. His face was very masked, and his voice was extremely quiet. So I'll just give you a quick review of this case, and then we'll go into some specific details. So we did a lot of different things with him. We did some laser, we did some supine shadow boxing, because I wanted him to be able to start moving quicker, but I didn't want him to have any risk of falling. We lots of metronome work with the ball. We found his ribs were not moving very well. He was 0 or 1 in his rib expansion measurement. We looked at his eye movements. We looked at his swallowing ability and his gag ability, and found that we needed to stimulate those. And then we found really good success in his case with yellow lenses, but it took a while to figure a lot of this out. We ended up seeing him for 8 visits over about a 2-week period, and then we followed up with him 3 or 4 months later. And the results, it was really fun to see his progress. and then it was able to maintain for several months. He had a resolution of his flank pain within about a week. And when you see these x-rays, you'll think it's pretty cool too, that he was able to get out of pain so quickly. So he had some improvement of his walking and balance, much more upright posture. His facial expression improved, his voice improved. He was able to start sleeping better. He had energy and his gut function improved. And he was able to achieve his main goal, which was to be able to carry and play with his 1-year-old granddaughter. So I just want you to take a look. It might be difficult to see, but I've highlighted it. This is just our AP lumbar. He had a history of a pain device that was put inside his spine, a spinal stimulator for chronic back pain. But if you look at that expansion, one of the first things I noticed was all these slightly displaced fractures here, here, here. I don't know if you can see my cursor, but it's sort of in the middle of that yellow box. And so that was good to know. He wasn't just, didn't have any bruised that we know of, bruised or bleeding organs, but he did have rib fractures. So that was his first day we saw him, and then we went over that with him. And that very first day, we started doing his seated rib expansion manipulation, his adjustments, and just lifting his other ribs so that he could have some better breathing, which to me is pretty important. This is going to be a little out of order, so forgive me for not being perfect, but we did a follow-up x-ray 4 months later, and you can see that he had quite a bit of improvement. I still don't think he was fully healed, but his ribs weren't hurting. He was breathing so much better, and he had started to make some good healing on that. Just review how I do my rib expansion measurements. I just put that tape behind, I do it from behind, and I put it under the subcostal margin, right under the chest in the front, and then I just overlap. And then I have them breathe in and out as full as they can. And I'm not really measuring what the circumference is of that, just the change in the measurement from expansion in inhalation to exhalation. And I'll just show you a quick video of how I did that with him. Baseline breathing. And out. Breathe in. And out. So about 4 centimeters. So about 4 centimeters, I said. And then we would adjust him and then remeasure it again. And almost always we were able to almost double that improvement, that measurement with that seated rib adjustment. And the seated rib adjustment, a lot of you I've learned it from a lot of you. I adapted it to my own style, but I just reach around from behind and I put my thenar eminence on the most tender rib, reinforce it, and then just gently lift and just a little impulse. Okay. So tell me really quick about your ribs. How have the ribs been feeling?
Very, very well. I was prepared for like 4 to 6 weeks of healing time and pain.
For the fractures?
Yeah. And the pain is gone. It's been almost a week.
Yeah, that's awesome.
That's really awesome.
Nice. Good job. Well, you've been working hard. Keep it up.
Thank you.
So I was actually surprised myself to see him improving as good as he did, as quickly as he did. But I think part of that is because of all the good functional medicine work that he had done with the other doctor in North Carolina. So let's look at a few more videos. Do that. All the way. So this is his get up and go test, and then I'll just play it out for a minute here. Sit. Now that's it. Okay, so then we treated him for 2 weeks, 4 visits a week, and then we'll see how he was moving after 8 visits.
I asked him, I said, have you ever pushed them on the swing? And he said, no. And I'm like, you're kidding me. So when we get home, the first thing he'll be doing is playing monster. With
Sit down.
and pushing them on the swing.
Nice. That is a get up and go test to be in my record books, right? So I've treated several, dozens of Parkinson's patients, but I've never seen people improve quite as quickly as he did. So I was pretty excited about that. Maybe that's why I was doing these videos, but it's pretty exciting. Do that?
Yeah.
So we gave him lots of different exercises to do. As I mentioned in the other slide, but this is just a picture they sent me showing that he was working on his crawling with his little grandchild, and apparently the grandchild was winning. So they were having a lot of fun. So I ran across this paper a few years ago. It talked about boxing training. It's more of a case study. I think it had, I can't remember, maybe 100 patients, or maybe it was 20 patients, a small sample size. But what it showed is that these patients who went through boxing training, and it was about 90 minutes, 60 to 90 minutes, 2 to 3 times per week for 12 weeks. And then some of them continued on, but they had improved, I think 5 of 12 outcome measures they improved on at the baseline compared to their 12-week final. And I just thought that was pretty cool. So in Pedro's case, we weren't able to actually have him jump around. He was just too advanced. So and I didn't want him to fall again. So I devised a exercise that seemed to work pretty well for him because he was able to start to move quicker. Let's go. So this is one of the combined exercises we're having him do. Punch it left, and then another one, up, down, up, down, right hand, do the right hand. Right hand again, let's get the foot and there we go, down, left hand, up, down, right hand, up, down, go. Yes, that's the way. Keep going. Thank you. Down. Now you got up. So that's the one. So I don't think this was the very first time I taught him. We started teaching him just with punching, and then he was punching as he pulled his other arm back, and he'd punch forward, punch and punch and punch. And then we added the feet on it, later that day, and then we would try to get him to do them together. And within a short time, he was getting things moving. I noticed that when we added the yellow glasses, for some reason, it just helped him move so much faster. That yellow filter helped him improve. So I'll let you take a look at this. Oh, punch me. Punch it. And then add the legs. Punch it. Punch it. Punch it. Faster. Yes. 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 Yeah. That's bigger. Punch quicker. Yes. Punch it. Yes. Yes. That's what we want. So he was able to get it going pretty well. And I think this is one of the things that really helped him feel like he could move, because he just had such a struggle with walking and moving. So here's one more when he was doing even better. This is after 2 weeks. Yeah, I'm gonna have to get, okay, that's good. And he just had so much fun. We had a lot of fun. We tried to make it fun. I would tease him a little bit, and his wife was there for some of the treatment, but not all of it, because she had to be out of town. But he was doing really well and started to really feel some progress. So one of the reasons, I don't know if it would happen in 8 visits, 2 weeks, but there's lots of studies to talk about the benefits of brain function and how aerobic exercise improves brain function in Parkinson's disease. But it wasn't stretching that would help, passive movement. It was active movement that helped him. So it's thought that aerobic exercise stabilizes the disease progression in the corticostriatal sensory motor network. And I noticed for sure that it enhanced his cognitive performance in this case. So I don't want to, I mean, there were so many different things we tried. I mean, we failed with so many things. So some of the things just didn't really help him. Other of those things seemed like it was making progress in just in a day or two. So with photobiomodulation, the laser, I mean, it has so many benefits. It increases the mitochondrial activity, and it improves energy production. We know that it decreases inflammation and decreases swelling, decreases pain, improves blood flow. So there's so many things it can do. I think it's really important to do some type of photobiomodulation to speed up the healing in the brain for Parkinson's. Did we directly contact the striatal nucleus, the substantia nigra? Probably not, but we did see some improvement in his energy, his fatigue levels improved, and his sleep improved as we started to do this laser. So I guess the reason why I was excited to share this case, it wasn't because I did such a great job. I was just surprised several of the things that we did had a great impact. Some of the stuff we tried just didn't do anything. And so I think as you're treating these neurodegenerative cases, you just have to realize that when these people are struggling, it affects everything in their family. Their psychology of the patient, plus the caregiver, and it's really important to have the families involved in the treatment process. As they were traveling back home, his wife sent me this text with a picture, and it says, "Look what you've done. This sweet man's goal was to be strong enough to hold his grandchildren and have balance enough to hold them and walk with them. And he's doing amazing." So I was just so excited, and I just got so close to that family just because I saw the improvement. And you know, to me, it wasn't about the money. It was just like, how can I help this amazing doctor have quality of life? So my challenge to all of you and my encouragement is to increase your ability and your skills so you can help people fight this battle. Sadly, I followed up in February with his wife, and she let me know that he had went back home and made progress and tried several other therapies, and then he ended up developing some more dementia and something called Benson's disease, and passed away. I think it was in 2023. So it can be frustrating and disheartening sometimes to treat some of these cases that are just going to die early. But I think it reminds me of, you know, yeah, we're all going to die, but I think we need to realize and remember that we are helping relieve suffering and helping people improve the quality of their life. And for the amount of time he was able to spend with his children, his wife, and go do some of the things they enjoyed together, and especially to spend time with his grandchildren, I think it was definitely worth it to them. It's interesting when you look at how many people with Parkinson's currently in the world, and they project it forward, it's going to double from around 7 million in 2015 to about 14.2 million in 2040. So, you know, that's 6 years ago is when 2015 was here. Should I say 9 years, since it's 2024, 9 years ago. And now in just another 20 or 30 years, it's going to be significantly more people who are going to need this kind of work. Now, I just trying to think if there's anything else I need to share, but what I just want you to remember is just be willing to fail. The faster you fail, the things you can do that are safe, that will fail, the quicker you learn to make those mistakes in practice, as long as you're not hurting people, the quicker you're going to learn to become better. And I've just noticed as I've treated more and more of these cases, I try the things that work, and sometimes they don't work on everybody. So I hope that this has been valuable. Thank you so much for your time, and good luck on your quiz. It should be pretty simple. Thank you so much.